Can you describe a time you provided high-quality, patient-centered care in a challenging situation?
One situation that stands out involved caring for an elderly patient admitted to the medical ward with advanced heart failure and poorly controlled diabetes. He was frequently distressed, refused medication, and his family had conflicting views about his care, which created tension and delays in treatment. The challenge was balancing clinical priorities with his emotional needs while maintaining trust with both the patient and his relatives. At the time, my responsibility was to stabilize his condition, ensure medication compliance, and support the family through decision-making. I started by spending time with the patient during quieter periods of the shift, sitting at eye level and encouraging him to express his concerns. It became clear that his refusal was driven by fear of losing independence rather than confusion about treatment. I adjusted my communication, explaining each intervention in simple terms and involving him in small choices, such as medication timing, where clinically safe. I also arranged a short multidisciplinary discussion with a cardiology registrar, dietitian, and his family, ensuring everyone heard the same information. This helped reduce misunderstandings and align expectations. Throughout his stay, I monitored his blood glucose closely, escalated concerns promptly, and documented changes clearly to support continuity of care across shifts. Within a few days, his engagement improved significantly. He began taking medications consistently, his clinical markers stabilized, and his anxiety reduced. His family later thanked the team for treating him with dignity and patience. This experience reinforced for me that high-quality, patient-centered care often requires slowing down, listening carefully, and adapting care plans to the person, not just the condition.
How do you prioritize patient safety when caring for multiple patients?
In busy clinical settings, prioritizing patient safety when caring for multiple patients requires structure, situational awareness, and clear communication. One example comes from an early shift on a surgical ward where I was responsible for 6 post-operative patients with varying acuity levels, including one who had returned from theater overnight and another with early signs of infection. At the start of the shift, I reviewed handover notes, observation charts, and medication schedules to identify immediate risks. I quickly recognized that the post-operative patient and the patient with rising temperature and tachycardia required closer monitoring. I reorganized my workflow to assess them first, completed focused assessments, and ensured all safety checks were done, including wound reviews, pain scores, and fluid balance. For lower-risk patients, I clustered care to reduce interruptions while still meeting essential needs. When competing demands arose, such as a medication round coinciding with a deteriorating observation score, I escalated promptly to the nurse in charge and requested temporary support. This ensured no tasks were rushed or missed. I also used clear documentation and verbal updates during shift changes to maintain continuity and reduce the risk of errors. By staying organized, reassessing priorities throughout the shift, and knowing when to ask for help, I was able to maintain patient safety despite workload pressures. All patients received medications on time, early sepsis was identified and treated, and the post-operative patient recovered without complications. This approach has consistently helped me manage multiple patients while keeping safety at the center of my practice.
Tell us about a time you advocated for a patient's needs.
I once cared for a middle-aged patient admitted to the orthopedic ward following a hip fracture repair. Although the surgery was successful, she was experiencing severe post-operative pain that was not adequately controlled with a prescribed analgesia. Despite repeatedly reporting pain scores of 8 out of 10, her concerns were initially attributed to anxiety, and there was hesitation to adjust her medication. As the nurse responsible for her care, I felt it was important to ensure her discomfort was taken seriously. I completed a thorough pain assessment, reviewed her medication chart, and documented the frequency and severity of her pain alongside its impact on her mobility and sleep. I then approached the on-call doctor with clear clinical evidence, explaining that her pain was preventing effective physiotherapy and increasing her risk of complications such as immobility and delayed recovery. When there was still some reluctance to change the plan, I escalated the concern to the nurse in charge and requested a review by the acute pain team. I also kept the patient informed throughout, reassuring her that her concerns were valid and that I was actively seeking support on her behalf. Following the review, her analgesia was adjusted, combining regular pain relief with breakthrough medication. Within 24 hours, her pain score reduced significantly. She was able to engage with physiotherapy, and her confidence improved. She later expressed gratitude for being listened to. This experience reinforced the importance of speaking up, using evidence-based assessments, and ensuring the patient's voice remains central to their care.
How do you ensure dignity and respect in your daily nursing practice?
Ensuring dignity and respect is central to my daily nursing practice, particularly when patients are at their most vulnerable. One example involved caring for a young adult patient on a medical ward who required full assistance with personal hygiene following an acute neurological episode. He was physically dependent but mentally alert, and he expressed embarrassment and frustration about losing his independence. My responsibility was to provide essential care while preserving his sense of self-worth. Before each intervention, I explained what I was doing and asked for his consent, even for routine tasks. I ensured privacy by closing curtains, limiting unnecessary interruptions, and involving only essential staff. I also encouraged him to participate as much as he could, such as washing his face or choosing clothing, which helped restore a sense of control. In another situation, I cared for an older patient with early dementia who became distressed during personal care. I adjusted my approach by using a calm tone, addressing her by name, and maintaining eye contact. I worked at her pace rather than rushing, which reduced agitation and preserved her dignity. Across all settings, I am mindful of cultural, personal, and emotional differences. I avoid discussing patients in public areas, use respectful language, and challenge inappropriate behavior when I encounter it. By consistently treating patients as individuals rather than tasks, I help create a safe, respectful environment where people feel valued and heard.
Describe a situation where you had to make a quick clinical decision to protect a patient.
A clear example occurred during a night shift on a medical ward when I was caring for a patient admitted with pneumonia and a history of chronic kidney disease. During routine observations, I noticed a sudden drop in oxygen saturation from 95% to 86% on room air, alongside increased respiratory rate and visible use of accessory muscles. The patient was also becoming increasingly drowsy, which was a significant change from earlier in the shift. Recognizing this as a potential acute deterioration, I acted immediately. I repositioned the patient upright, commenced oxygen therapy as per protocol, and performed a rapid respiratory assessment while calling for support. I informed the nurse in charge and contacted the on-call medical team using clear, structured communication, highlighting the rapid changes and relevant background. While waiting for review, I increased the frequency of observations, ensured intravenous access was patent, and prepared emergency equipment in case further intervention was required. The doctor arrived promptly, and investigations confirmed worsening infection and early respiratory failure. The patient was started on intravenous antibiotics, nebulizers, and was later transferred to a higher dependency unit for closer monitoring. Because the deterioration was identified early and escalated without delay, the patient stabilized and avoided the need for intubation. This experience reinforced the importance of vigilance, trusting clinical judgment, and acting decisively. Making timely decisions under pressure can significantly change outcomes, and I consistently apply this approach to protect patient safety in my daily practice.
Tell us about a time you supported a distressed patient or family member.
I recall caring for a patient in the intensive care unit whose condition deteriorated unexpectedly following emergency abdominal surgery. His wife arrived shortly after being informed of the change and was visibly distressed, struggling to understand the situation and fearful of losing him. The clinical environment was overwhelming for her, and she felt excluded from what was happening around her. While continuing to manage the patient's care, I recognized the importance of supporting her emotionally. I guided her to a quiet area away from the bedside and took time to listen without interrupting, allowing her to express her fears and ask questions. I explained her husband's condition in clear, non-technical language, checking her understanding and being honest about uncertainties while offering reassurance that he was receiving continuous focused care. I also liaised with the medical team to ensure she received consistent information and arranged for her to speak with a consultant once the immediate interventions were completed. During visiting hours, I stayed nearby to answer questions and prepared her for what she might see, which reduced her anxiety and helped her feel more in control. Over the following days, her distress noticeably reduced. She became more engaged in care discussions and later thanked the team for their compassion and clarity during a very difficult time. This experience reinforced for me that emotional support is an essential part of nursing care and can significantly influence how patients and families cope during critical situations.
How do you manage emotionally difficult situations while remaining professional?
Emotionally difficult situations are a regular part of nursing, and I manage them by staying grounded in professionalism while acknowledging my own responses. One example involved caring for a young patient who deteriorated rapidly despite all appropriate interventions. The situation was distressing for the family and for staff, as the outcome was not what anyone had hoped for. During the shift, my focus was on providing calm, consistent care and supporting the family at the bedside. I maintained clear communication, used a steady tone, and ensured the patient's comfort and dignity were preserved at all times. Even when emotions were high, I avoided showing panic or frustration, as I knew this would affect the family's trust and the team's ability to function effectively. After the situation was stabilized and the family had time with the patient, I took appropriate steps to process the experience. I spoke with the nurse in charge and later participated in a team debrief, which helped me reflect on the care provided and manage the emotional impact in a healthy way. I also recognize the importance of self-care, such as taking short breaks when possible and seeking support from colleagues when needed. By separating the emotional weight of the situation from the clinical decisions required in the moment, I'm able to remain professional, compassionate, and effective. This balance allows me to continue delivering safe, high-quality care without becoming emotionally overwhelmed.
Can you give an example of how you showed empathy in your nursing role?
One example of showing empathy occurred while I was caring for a patient newly diagnosed with chronic kidney disease on a medical ward. He was in his early 40s and was struggling to come to terms with the long-term impact of the diagnosis on his work and family life. Although his physical condition was stable, he appeared withdrawn and repeatedly expressed fear about the future. Rather than focusing only on routine observations and medications, I made time to sit with him during my shift and invite him to talk. I listened carefully without rushing or offering false reassurance, acknowledging how overwhelming the diagnosis must feel. I adapted my communication to his level of understanding, explaining the treatment plan in clear, manageable steps and checking regularly that he felt comfortable asking questions. I also arranged for the renal nurse specialist to meet with him and provided written information he could review at his own pace. Recognizing that emotional support was just as important as clinical care, I encouraged him to involve a family member in discussions so he did not feel he was coping alone. By the end of his admission, he appeared more engaged and confident in managing his condition. He thanked me for treating him as a person rather than just a diagnosis. This experience reinforced that empathy in nursing often means taking the time to listen, validate feelings, and support patients through uncertainty as well as illness.
Describe a time you cared for a patient with complex emotional or social needs.
I once cared for a patient admitted to the medical ward with poorly controlled asthma who was frequently readmitted due to noncompliance with treatment. Initially, this was viewed as a purely clinical issue, but during my interactions with him, it became clear that there were significant emotional and social factors affecting his health. He was living alone, had limited family support, and was experiencing anxiety and financial stress after losing his job. My responsibility was to manage his acute symptoms while addressing the underlying issues contributing to his repeated admissions. I took time to build rapport and asked open questions about his daily routine and challenges, which helped him feel comfortable sharing concerns he had not previously disclosed. I adjusted my communication style, avoided medical jargon, and focused on practical problem-solving rather than judgment. I liaised with a multidisciplinary team, including the respiratory nurse specialist, social worker, and occupational therapist, to create a more realistic discharge plan. This included arranging community follow-up, support with medication management, and advice on accessing financial and social support services. I also provided clear education on inhaler technique and early warning signs, checking his understanding before discharge. Following this approach, his confidence improved and he expressed feeling more supported and understood. In the months that followed, his readmissions were reduced. This experience highlighted for me that addressing emotional and social needs alongside physical care is essential for achieving meaningful, long-term health outcomes.
How do you maintain compassion when under pressure or short-staffed?
Working under pressure or with reduced staffing is a common challenge in nursing, and maintaining compassion in these situations requires conscious effort and prioritization. One example comes from a particularly busy shift on a medical ward where staff sickness meant I was caring for more patients than usual, several of whom required frequent monitoring and assistance. At the start of the shift, I acknowledged that time would be limited, so I focused on being fully present during each interaction, even if it was brief. Simple actions such as making eye contact, using the patient's name, and explaining delays honestly helped patients feel respected rather than rushed. When a patient became frustrated about waiting for assistance, I listened to their concerns, apologized for the delay, and reassured them that their needs were important. I also worked closely with colleagues, sharing updates and offering help where possible to reduce overall stress on the team. By communicating clearly and supporting one another, we were able to maintain a calmer environment despite the workload. Although tasks had to be prioritized carefully, I made a point of not letting pressure affect my tone or behavior. At the end of the shift, patients' essential needs were met safely, and several expressed appreciation for the kindness shown despite how busy the ward was. This experience reinforced that compassion does not always require extra time, but rather a mindful approach to how care is delivered.
Describe a time you worked effectively as part of a multidisciplinary team.
A strong example of effective multidisciplinary working took place while I was caring for a patient on a stroke rehabilitation ward following an acute cerebrovascular accident. The patient had reduced mobility, speech difficulties, and low mood, which made recovery complex and slow. Progress had plateaued, and there was concern about delayed discharge and loss of motivation. As the primary nurse, my role was to coordinate daily care while contributing to the wider rehabilitation plan. I noticed the patient was disengaging during therapy sessions and refusing meals, which risked further decline. I raised these concerns during the weekly MDT meeting, involving the physiotherapist, occupational therapist, speech and language therapist, dietitian, and medical team. I shared specific observations from day-to-day care, including mood changes, fatigue patterns, and barriers the patient expressed during conversations at the bedside. Together, we adjusted the care plan. Therapy sessions were rescheduled to align with times when the patient had more energy, nutritional support was adapted to accommodate swallowing difficulties, and psychology input was requested to address low mood. I reinforced therapy goals during routine nursing care, encouraging small, achievable steps and providing consistent feedback to the team. Over the following weeks, the patient became more engaged, mobility improved, and nutritional intake increased. He was eventually discharged home with community rehabilitation support in place. This experience showed me how effective multidisciplinary collaboration relies on clear communication, mutual respect, and the nursing role as a key link between patients and the wider team.
Tell us about a situation where communication was critical to patient care.
Effective communication was critical in a situation involving a patient admitted through the emergency department with sepsis of unknown origin. The patient's condition was deteriorating rapidly, and several teams were involved, including emergency, medical, and critical care staff. The challenge was ensuring that essential information was shared clearly and promptly to avoid delays in treatment. During my assessment, I identified worsening observations, reduced urine output, and increasing confusion. I gathered all relevant information, including recent vital signs, blood results, fluid balance, and response to initial treatment. I then contacted the medical team and clearly communicated the urgency of the situation, emphasizing the rapid changes and potential risks if escalation was delayed. As care progressed, I ensured updates were handed over accurately between shifts and teams, documenting interventions and responses in real time. I also communicated regularly with the patient's family, explaining what was happening in straightforward language and preparing them for the possibility of transfer to a higher level of care. This helped reduce their anxiety and maintain trust during a highly stressful period. The patient was transferred to the high-dependency unit, where aggressive treatment was initiated promptly. Early escalation and clear communication contributed to stabilization and recovery. This experience reinforced that in complex or rapidly changing situations, precise, timely communication can directly influence outcomes and is a core responsibility within my nursing role.
Have you ever made a mistake at work? How did you handle it?
Yes, I have made a mistake, and I believe how it is handled is critical to patient safety and professional integrity. Early in my career on a busy medical ward, I realized that I had administered a routine oral medication later than prescribed due to an unexpectedly high workload and an urgent patient deterioration that required immediate attention. As soon as I recognized the error, I assessed the patient to ensure there were no adverse effects and checked the medication's time sensitivity. I then informed the nurse in charge and documented the delay clearly in the patient's notes, following local incident reporting procedures. I also informed the medical team so they were aware and could decide if any further action was required. Transparency was important to me, and I made sure the patient was informed in an appropriate and reassuring way. After the shift, I reflected on what had contributed to the mistake. I realized that although prioritizing the unwell patient was necessary, I could have asked for support earlier to ensure routine medications were not delayed. I discussed this with my senior nurse and adjusted my practice by reorganizing medication rounds more effectively and communicating workload pressure sooner. There was no harm to the patient, but the experience had a lasting impact on how I manage competing priorities. It reinforced the importance of accountability, timely escalation, and learning from errors rather than hiding them. Since then, I have been more proactive in seeking support during high-pressure shifts and have not repeated the same issue. I see mistakes as opportunities to improve practice and strengthen patient safety.
How do you build trust with patients, families, and colleagues?
Building trust with patients, families, and colleagues is something I approach through consistency, honesty, and respect. Trust develops when people feel listened to and confident that their concerns will be taken seriously. One example involved caring for a patient with a long-term condition who had frequent hospital admissions and was initially guarded with staff due to previous negative experiences. I took time to introduce myself properly at the start of each shift, explain my role, and followed through on what I said I would do. When delays occurred, I was honest rather than avoiding difficult conversations. I also encouraged questions and made sure information was explained in a way the patient and family could understand. Over time, they became more open and engaged in care decisions, which improved cooperation and outcomes. With colleagues, trust is built by being reliable and supportive. On a surgical ward, I worked closely with healthcare assistants and junior doctors, sharing relevant updates promptly and offering help during busy periods. When I was unsure about something, I asked for guidance rather than making assumptions, which helped maintain patient safety and professional respect. I also believe trust involves accountability. If an issue arises, I address it directly and reflect on how to improve. By being approachable, communicating clearly, and maintaining professional standards, I create working relationships based on mutual respect. This approach helps foster a positive team environment and ensures patients and families feel safe, valued, and confident in the care they receive.
Describe a time you dealt with conflict in the workplace.
A challenging situation involving workplace conflict occurred while I was working on a busy surgical ward during a period of high staff turnover. Tension developed between myself and a colleague over task allocation, particularly during medication rounds and patient transfers. The situation began to affect communication and risked impacting patient care, which was my main concern. As the shift progressed, I noticed that information was not being shared clearly, and there was visible frustration on both sides. Rather than allowing this to continue, I asked to speak with my colleague privately during a quieter moment. I approached the conversation calmly and professionally, focusing on how the situation was affecting teamwork rather than assigning blame. I explained my perspective and invited them to share theirs, which helped uncover that they were feeling overwhelmed and unsupported due to an increased workload. Together, we agreed on a clearer way to divide responsibilities for the remainder of the shift and committed to checking in with each other during busy periods. I also suggested involving the nurse in charge to help clarify expectations and ensure support was distributed fairly across the team. This helped relieve pressure and prevented similar issues from arising later in the shift. Following this conversation, communication improved noticeably. Tasks were completed more efficiently, and the atmosphere on the ward became calmer. Most importantly, patient care continued safely and without disruption. This experience reinforced for me that addressing conflict early, listening actively, and keeping the focus on shared goals are essential for maintaining professionalism and a safe working environment.
Tell us about a time you reflected on your practice and made an improvement.
One example of reflecting on my practice occurred while I was working on a medical ward and noticed that patients were often anxious during admission, particularly when multiple assessments were carried out in a short time. Although all clinical tasks were being completed appropriately, I realized that patients frequently appeared confused and overwhelmed, which sometimes led to repeated questions and reduced engagement with care. After reflecting on this pattern, I recognized that my focus had been heavily task-driven during busy shifts, and I was not always checking how much information patients were absorbing. I decided to adjust my approach by slowing down slightly at the start of each admission, clearly explaining the sequence of events and what the patient could expect over the next few hours. I also made a conscious effort to pause and ask patients to repeat key information back to me, ensuring understanding. I trialed this approach over several weeks and noticed a clear difference. Patients appeared calmer, asked fewer repetitive questions, and were more cooperative during assessments. Feedback from colleagues also indicated that patients were better prepared for procedures and investigations, which improved overall workflow. This reflection helped me understand that small changes in communication can have a significant impact on patient experience and efficiency. Since then, I regularly reflect on my practice, especially after challenging shifts, and look for practical adjustments that can improve care quality. This habit has helped me continue to develop professionally and deliver more patient-centered care.
17. How do you keep your nursing knowledge and skills up to date?
Keeping my nursing knowledge and skills up to date is an ongoing responsibility that I take seriously, as it directly affects patient safety and quality of care. I use a combination of formal learning, reflective practice, and day-to-day clinical exposure to stay current. In my workplace, I actively participate in mandatory training and update sessions, such as life support, infection control, safeguarding, and medication management. When new guidelines or protocols are introduced, I make a point of reviewing them carefully and asking questions if anything is unclear. For example, when sepsis screening tools were updated on my ward, I familiarized myself with the changes and applied them in practice, which improved early recognition and escalation. I also learn a great deal through reflective practice. After managing complex cases or unfamiliar situations, I take time to review what went well and where I could improve. I discuss these experiences with senior nurses or mentors, which helps broaden my clinical perspective and strengthen decision-making. In addition, I keep informed by reading professional journals, online learning resources, and evidence-based guidelines relevant to my area of practice. I seek opportunities to develop new skills, such as observing specialist nurses or supporting junior staff, which reinforces my own learning. By combining structured education with reflection and practical experience, I ensure my practice remains safe, current, and aligned with best evidence, allowing me to provide high-quality care in a constantly evolving healthcare environment.
Describe a situation where you received constructive feedback. How did you respond?
One situation where I received constructive feedback occurred early in my role on a busy medical ward. A senior nurse observed that while my clinical assessments were thorough, my documentation was often completed at the end of the shift rather than in real time. Although no errors had occurred, she explained that delayed documentation could increase risks during handover or if a patient's condition changed suddenly. Initially, I felt disappointed as I took pride in my work, but I recognized that the feedback was intended to improve patient safety rather than criticize my ability. I thanked her for raising the issue and asked for specific examples so I could understand the impact more clearly. She highlighted occasions where colleagues needed to rely on verbal updates because notes were not yet fully updated. In response, I adjusted my practice by prioritizing brief, timely documentation after key interventions and assessments, even during busy shifts. I also developed a system to organize my workload more effectively, allowing me to balance patient care with accurate record keeping. I reviewed documentation standards and asked the senior nurse to review my notes after a few weeks to ensure I was meeting expectations. As a result, my documentation became clearer, more timely, and more useful for the wider team. The feedback helped me improve both my efficiency and contribution to continuity of care. This experience reinforced that being open to constructive feedback is essential for professional growth and improving the quality and safety of nursing practice.
Can you give an example of when you adapted to change in the workplace?
One clear example of adapting to change occurred when I was working on a medical ward that was rapidly restructured to accommodate an increased number of high-acuity patients. Staffing patterns changed, new protocols were introduced, and nurses were required to take on unfamiliar responsibilities at short notice. This created uncertainty and pressure, particularly during the initial weeks. My priority was to maintain safe, consistent care despite the changes. I familiarized myself quickly with the updated guidelines and asked senior staff for clarification when needed rather than making assumptions. I remained flexible with shift patterns and willingly supported colleagues who were adjusting at the same time. When redeployed to care for patients with higher dependency needs, I sought supervision and refreshed key skills to ensure I remained within safe practice. I also adapted my communication style, recognizing that clear, calm handovers were essential during this transition. I made sure important information was shared accurately and supported junior staff who were less confident in the new environment. By staying organized and open to learning, I was able to adjust my workflow without compromising patient safety. Over time, the ward became more settled, and patient outcomes remained positive despite increased demand. This experience strengthened my ability to cope with change, remain professional under pressure, and support team resilience. It reinforced that adaptability, a willingness to learn, and clear communication are essential qualities in a constantly evolving healthcare setting.
How do you contribute to a culture of learning and improvement in your team?
I contribute to a culture of learning and improvement by being reflective, approachable, and willing to share knowledge in everyday practice. I believe learning happens most effectively when people feel safe to ask questions and discuss challenges without fear of judgment. One example occurred on a medical ward where several junior staff were newly appointed and lacked confidence with certain clinical skills. During shifts, I made myself available to support them, explaining procedures step by step and encouraging them to talk through their clinical reasoning. When incidents or near misses occurred, I focused on what could be learned rather than who was at fault, which helped promote open discussion and shared responsibility. I also contribute by sharing learning from training sessions or recent updates. For example, after attending an update on early deterioration recognition, I discussed key points during handover and applied them in practice, which helped improve team awareness and escalation. I encourage colleagues to reflect after challenging cases and take part in debriefs, particularly after emotionally demanding situations. By asking for feedback on my own practice, I set an example that learning applies to everyone, regardless of experience. This approach has helped create a supportive environment where staff feel valued and motivated to improve. Ultimately, fostering continuous learning strengthens teamwork, improves confidence, and leads to safer, higher quality patient care.